Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM and WUFO 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, Manager Workforce Development. Who is Kaleida? I know I say this every other week, but I just want to make sure you know because there can be confusion. We are hospitals: Buffalo General Medical Center, Millard Fillmore Suburban, Oishei Children's Hospital, Gates Vascular Institute, um, and I did say Millard Fillmore Suburban. We are also full time meaning 24 hours a day, 7 days a week. We come to your home. That is the Visiting Nursing Association. Also, Kaleida Health, we have medical practices throughout Buffalo, Southern Tier. We have Olean General, Olean Memorial Hospital. We also have a hospital in Bradford. We have full service clinics for children and adults north of the city of Buffalo, south of the city of Buffalo. I also forgot to mention our DeGraff. We have DeGraff long-term care, as well as High Point on Michigan long-term care. We have full service cancer services, which is a topic for today. We'll be speaking with Dr. Tambar. But at Kaleida Health, we offer full service cancer services from diagnosis to surgery to social workers. So when you think about Kaleida, please consider having your health care with Kaleida. Oh, I'm sorry, I forgot to mention general physicians. Kaleida has grown so much in the 20 years that I have been with the organization. And I'm just proud to say, I'm just proud to be part of this growing healthcare family. Also, if you're looking for a job or changing careers, please visit our website at www.kaleidahealth.org/careers, where you will find over 900 positions available. Positions that some of them require a high school degree, diploma, or a GED. Others require certification, clinical. We have all types of positions, full-time, part-time, per diem at Kaleida. Well, I'm going to get into our show for today. Our topic for today, this is October. October is Breast Cancer Awareness Month. Well, really every month should be breast cancer awareness month, but October is dedicated to that. So today's topic is Breast Cancer Awareness Month, early detection and advanced treatment. And our guest is Dr. Sudhi J. Tambar. Good morning, Dr. Tambar. How are you?
Good morning, Francesca. How are you today?
Great. And Dr. Tambar is a breast surgical oncologist, professor as clinical assistant professor at UB Jacob School of Medicine, and also associate dean for admissions. So I just wanted to mention that our guest, Dr. Tambar. Did I miss anything in your title?
No, I think you just mentioned I'm Associate Deans for Admission. I'm not. I'm Associate Program Director for the residency.
Okay, thank you. Well, our first, thank you so much for that clarification. Our first question, I'm just wondering, did you become interested? Well, what made you become, what piqued your interest in becoming a breast cancer surgeon?
As a woman growing up, I wanted to advocate more for the women's health. And during general surgery, when I got the opportunity to explore breast cancer and overall breast care at Roswell Park, I was very excited to be part of that field and be able to provide care to women and advocate for their health. So that was a peak reason in my third year of residency when I decided to go into breast surgery as a career.
Oh, thank you. And one thing when I was reading up about all of your work, one of the things I know you are very passionate about is early detection. So my question is, how important is early detection, and does early detection mean monthly self-examinations or annual mammographies? What does early detection mean?
Yes, early detection is the earliest stage of breast cancer that can be detected. And the earlier we detect the breast cancer, the higher the rate of cures with less aggressive treatments, which men tolerate better. So, yes, and annual mammograms and monthly self-breast exams are part of it, along with clinical breast exam that can be performed by your primary care, your GYN, or your breast surgeon once a year to also provide clinical exam, because a lot of things could be missed on mammograms if they're on skin surface that may be only picked up on an examination.
Mm-hmm. I've known of women who do their monthly breast self-examination and they have found a lump. Yeah, and I guess that's a question. What I want to make sure our listeners know, what does a lump feel like? Because I've had a couple of friends who have done their self-examinations and they have gone to the doctor to say, I feel a lump. Is that common for women to do that?
It's very common. It's fairly common for premenopausal women to have benign lumps in their breast. But regardless, any new lump, any new finding in the breast should be checked out with at least a physical examination by your physician, again, GYN, or your primary, or your breast surgeon if you have one linked up with. But definitely, any new finding, lumps tends to be more common that are women able to appreciate. And the most common ways described in the literature is tennis ball under the mattress. So you feel like there is a ball that's deep into your breast that you're able to feel. There could be some superficial lumps that you're able to feel more readily, but the deeper lump tends to be more common. And younger the women, the denser the breast they have, they have more lumpy, bumpy breasts, like we call them. And it's harder to do self-breast exam. And it happens not too frequently, thankfully, but where women have negative mammograms, but they present with a lump. And on mammogram and then sonogram, we actually find masses that were not even detected on mammogram. So it's extremely important for women to go through those multiple different modalities of breast care, which includes the imaging, the self-exam, and an examination by primary care to make sure we are detecting cancer at the earliest stage.
Mm-hmm. And what age should women begin breast self-examinations?
So we call it breast awareness should really start at earliest like 18 years of age for all women. So all women should be taught by their as they are getting transition from a pediatrician to an adult primary care or to a GYN who takes care of them, just to be aware of the breast and at least given some teaching about what to look for in your breast every month as you're looking at the mirror. But the self breast exam, usually we recommend after the age of 25. And the mammogram for women with average risk starts at the age of 40 and then annually thereafter. So they should undergo mammograms every year.
And then what if a woman is at higher risk, like her mother and her mother's sister? And is it just women? So if your mother and your aunt have had breast cancer, is it for breast self-examination, how or not self-breast examination, coming in for a breast for a checkup? Is it men or men and women? If both your mother, let's say your mother or your mother and your aunt have both had breast cancer, is this something that women should be coming earlier? Is it something men and women, if it runs in their family, should come in to see you?
Yes. So if there is a pattern of breast cancer in the family, so mother, grandmother, aunts along with it, so some kind of a pattern that you can draw, definitely there is a higher risk. And we recommend those women who have established history, at least of cancer, go to genetic testing to see if there's any mutation that can be identified running in the family. And usually children of those women who have been identified to have a mutation or just higher risk because of the pattern of the history, even if there's no mutation, we do recommend women undergo mammogram, MRIs, physical examination every single year. For men, the risk tends to be lower for their own cancer. So an average woman, for example, has a risk of 12% in their lifetime to develop a breast cancer. But men, even with a mutation, would only have a 6% risk. So men themselves don't need, there's no defined screening for male with genetic mutation, but the children of those men could inherit that gene and then have that elevated risk. So men should be aware of their risk because they may not themselves show up breast cancer, but if they end up having children who are girls, they are passing
Yes.
that risk unknowingly to their children, who will then again have that elevated risk of breast cancer. So men may not do it for themselves, but maybe for the next generation.
For the next generation. I know this question wasn't on one of our questions, but are you aware of, and I don't know, I've heard, you hear things that if your father has prostate cancer and your mother has, or if your father has prostate cancer, or you're at greater risk of developing breast cancer. Have you heard about that, or have you ever heard anything like that before?
Isolated history of prostate cancer in father tends to not increase your risk of breast cancer. But again, if you can establish a pattern where the maternal grandmother had breast cancer or ovarian cancer and father had prostate cancer, then you start to see some kind of mutation or higher risk being passed down the generation. Because again, the father will probably not have breast cancer since the risk is so low, but they may manifest a prostate cancer. But an isolated prostate cancer without any other cancer in the family, in the aunts or the grandmother, tends to not confer a higher risk on its own.
Okay. I something else that again and doing research and just reading up on you, it also talked about something about that you've done quite a bit in advanced treatments. Could you share with our listeners what are some advanced treatments? I mean, breast cancer has been around for years, and I'm sure, depending upon your age, you've known someone who may have had breast cancer 20 years ago, who then you really didn't live long, to someone who now has breast cancer, and people are celebrating their breast cancer anniversaries. It's because it's no longer what it used to be if caught early. So what are some of the advanced treatments that have made women, especially women, still survive?
Yes, so the breast cancer treatment is a multimodality approach where one modality of treatment alone is usually not enough. So, and by modality, I mean surgery, radiation, and medications. And leaps and bounds have been reached in treatments in all aspects, thankfully. So, in terms of surgery, just maybe 50 years ago, any woman presenting with a breast mass would just have modified radical mastectomy. I'm sorry, radical mastectomy, which is removing the entire breast, the muscle, the entire skin of the chest wall, take out all the lymph nodes. Women will have gaping holes in their chest where skin graft needs to be done, and they would have much higher risk for lymphedema due to aggressive lymph node dissection. So, we have come far away from that. We're definitely not doing radical mastectomies anymore. We are reducing the amount of tissue that needs to be removed from the breast. We are doing oncoplasty and reduction to make women's breast appear regular, like normal, like their natural self. And we are reducing the amount of lymph nodes we remove to reduce their risk from lymphedema. So just surgically alone, we have tried to do less surgery while maintaining the same outcomes. In radiation, we are starting to manage radiation so women's lungs and hearts are not radiated due to proximity to those organs during radiation. And much more leaps and bounds have been reached in medical oncology with the new medications. Immunotherapy, chemotherapies are becoming more sophisticated. We are doing targeted treatments with immunotherapy for more aggressive types of breast cancer. And I mean, the outcomes have remained the same, just as they were with radical mastectomy, where women were not not because the cancer killed them, but the side effects of those aggressive treatments killed them. So we are trying to reduce intervention while still maintaining the outcome.
Mm-hmm. And I know also that in terms of you're talking about advanced treatments. I've known women who have had breast cancer, and then and what you can talk about. What is the follow up? I've known, some ladies who have gone. Is there a protocol for after you've had breast cancer? You're a breast cancer survivor. Woo-hoo. And then what is a follow-up? Is it like you follow up for a month? You follow up for a couple of years? What is a follow-up to make sure that ugly cancer does not come back?
Yeah, so follow-up is very defined to national guidelines. So follow-up is for 10 years is usual follow-up. First 5 years is closer follow-up due to higher risk of recurrence during that time frame. So we follow patients every 6 months for clinical exam. Women with higher risk, for example, younger age, more aggressive breast cancer, tend to MRIs even after their surgeries or their treatments complete. And after those 5 years are complete, we usually do space out to once a year follow up because the risk of recurrence goes down after the 5 years are complete. Never zero, but it definitely goes down substantially to the point where it's reasonable to spread out to once a year follow up because women do want to live their life and don't want to be tied up to following physicians. And multiple of those is for with usually with breast surgeon and with medical oncologist. So, but first 5 years definitely is a closer follow up due to higher risk of cancer returning.
Yeah, because I have known a few women who have had the 10 year, and they're at that stage where it hasn't come back, and then something happened and they went back for a visit, but whatever they thought, whatever showed up on the X-ray, I guess for like I'm not sure if it's called X-ray, but it was negative. So just really glad that this person is still with us and she's cancer free. So that's it's just wonderful. So if someone
Yeah, we do. I'm sorry,
mhm,
we do still recommend they keep doing the imaging. They may not follow up as a physical exam and review of images, but the mammogram recommendations do not disappear after 10 years. They are recommended to continue having images. I should have mentioned that before.
and ladies, I must say, and even gentlemen, but ladies, if you're afraid of that, of going back after 10 years because you're afraid that you may not have, it may not be the news you want to hear, please call a friend. Please call a friend in advance. And hopefully they'll be so they can give you a ride. Call someone. If you're afraid, and I know fear is real, please call somebody, a friend who will go with you, and give them a couple of days in case they have to change an appointment, because we definitely want you to be cancer free. So I just wanted to add that. Please call someone and don't just let it go. That's what I'm saying. Don't let it go. We need you. We need you. We want you to be healthy. That's why we have Dr. Tambar on the show to talk about it. Yeah. So Dr. Tambar, if a woman right now, let's say she doesn't have a primary care physician, however, she feels a lump in her breast or she hasn't had a mammography in 8 or 10 years, would she go straight to like, what would she call your office? Where would she start if she knows she needs a mammography, and hasn't had one? What would be your advice?
Yeah, there are multiple routes for women who have new breast finding. Obviously, they can't say it's cancer, but they can
Right.
start with their primary care if they have one established and go to that route, get the images done. They can go to their GYN provider. Same thing, have them examine and do an imaging. That I do take referrals directly, and I do ultrasounds in the office myself. I do same day biopsies. So women with higher risk or who have more concerning images, I do same within 24 to 48-hour appointments and same day biopsies because breast cancer is very anxiety provoking, just the thought of having breast cancer. So to ask women to wait for imaging or wait for a biopsy for 2 weeks, I believe is unreasonable. So I, for that reason, provide the biopsy services in the office for the same day.
And where's your office or offices? Where are you located?
Yeah, so I do cover a lot of different areas just because there's access an issue in pockets of areas around Buffalo. So I go to Orchard Park. I'm in downtown Buffalo at Buffalo General Hospital. I am in suburban up in on Youngs Road next to the suburban hospital, and I will be starting a clinic in Warsaw starting December of this year.
Oh, wonderful. So, listener, she said Warsaw, Orchard Park, Buffalo, and Amherst. And that's basically when I talk about Kaleida offering services, health services, throughout Erie County, north of Buffalo, south of Buffalo. Dr. Tambar and her practice is a perfect example of that. And I just want to say that, yeah, uh, don't be afraid. And if you haven't been to an OBGYN, I'm sorry, if you have not had a breast examination in say 10, 15 years, it's changed a lot. It's no longer those cold metal slabs. They are warm, they are padded. So don't be afraid. Don't think negatively. Please don't think negatively, because even the machines have changed for how for a breast examination. It's quite I mean, I'm speaking from experience. It's quite comfortable, and it isn't like it was 20 years ago where it was cold. It's warm. Right. It's not the equipment has changed quite a bit. Do you agree with that, Dr. Tambar?
Yes, it's not metal anymore. I actually was the fortunate one who never had the mammogram, all in the olden times when there was metal, I guess.
Yeah.
They are plastic, they are warm, they are comfortable. The techs who do the mammogram are highly trained in not just the technique of mammogram, but also the art of it in making the women look comfortable. And that's across the board. I have had mammograms in different locations, and never I felt like I was just one of the numbers in their checklist. They do take care, because most of them are women themselves, and they understand what women go through, not in terms of physical discomfort, but also the anxiety associated with the screening study. So they tend to be compassionate, and they are caring, and they, again, use the art of medicine when they are taking patients through a mammogram.
Mm-hmm. Now, I've been asking a lot of questions. Dr. Tambar, is there something you would like to share with the listeners? We have a few minutes.
I would just reiterate what we said. Know your family history, know if you're higher risk. Information is power, and that's how we beat cancer. Early detection, knowing your risk, getting those screenings. If you qualify for an MRI, we get you there every single year to make sure that you get the appropriate images if you have a higher risk. So knowledge is power, be it by mammogram, be it by knowing your family history, genetic testing, and that's how we save women.
Genetic testing. What is that? Can we just talk a little bit about what is genetic testing?
Yes. So genetic testing is available pretty much in all disease sites, not just breast. I obviously talk more about breast, but genetic testing is where we look if there's anything wrong in the DNA that is leading to this, that led to this cancer. And the implication of having a genetic mutation is most genetic mutation imply more than one disease organ that is at risk for breast cancer. For example, BRCA mutation, that's the more popular known mutation. Angelina Jolie had it, and she had a breast removed prophylactically because of the elevated risk. So that if somebody has a BRCA mutation, like we call it, in addition to breast, they are also at risk for developing ovarian cancer in their lifetime. And the recommendation is to remove their ovaries. So having the genetic testing, which is a simple blood draw, it's nothing extraordinary. You just give a tube of blood, just like you do with any other blood test. And we test for 36 genes in breast cancer testing. But if you have colon cancer, if you have lung cancer, there are different genetic panels available for those different types of breast cancer risk that may be associated. For example, there are other genetic testing available that looks for breast cancer along with pancreatic cancer. There's breast cancer along with thyroid cancer. So there's multiple different types of genetic mutation that can confer risk of different organs. So knowing those risks would mean not only you need breast screening, but you may also need screening for those other organs, or at least awareness and keeping screening for them, or getting physical examinations or imaging to detect cancer of that site in addition to breast.
So if you're a little younger, let's say you're 38, and you go for this genetic testing and things pop up, you know, different possible cancers appear in the blood test. Does it like move you to the top of the line? Can you then maybe have your mammography at age 40? Is that what it does? If it recognizes something with the cancer, you were then able to get a screening at an earlier age?
That is correct. So if genetic mutation is identified, especially BRCA, I mean, we start MRIs at the age of 25, depending on how soon these mutations are identified. So if a higher risk of cancer based on mutation is identified, patients do get moved up in a line, like you said. We have genetic counselor who actually specializes in all genetic mutations of different disease sites, and she actually would have an hour-long consultation with patients to go over their genetic testing results, what other organs are at risk, how to screen for them, set them up with those different providers, because of course I specialize in breast, but if a woman has, in addition to breast, ovarian cancer risk, then she would be linked with gyn-oncology clinic who actually monitor patients who have higher risk and follow protocols for their own screening. So there are extensive services around genetic risk of cancer. So yeah, so women, if they know their risk, they should get genetic testing, at least see if they qualify for genetic testing, because insurance covers these tests if you have high enough risk. This is usually tends to be not out of pocket, but obviously some women just want to know their risk and they do get testing. Even if the insurance does not cover, it costs about $200. It is $200. It's not ridiculous. It's not cheap either, but it was somewhat reasonable to have the genetic testing if somebody is curious, but is not able to establish a family history or a pattern of cancers. So and there, as I said, different testing for different disease sites, colon, lungs, breast, for example, and depending on the results, we have a counselor who would go through every single one of those patients and counsel them about their risk and how it should be monitored and managed.
Wow, Dr. Tambar, I can tell you right now that we will be airing this show. The show is airing on Saturday. And I know we will be airing this show again because there's so much information in this interview, everything from early detection, advanced treatment, and now genetic testing. This is wonderful information. And I want to thank you for being our guest this morning in the first half of the Great Lakes Health radio program. Thank you so much. And thank you for sharing your knowledge during this Breast Cancer Awareness Month, which I always say every month is Breast Cancer Awareness Month. So I want to thank you, Dr. Tambar, for being our guest this morning.
Thank you, thank you for giving me the opportunity, Francesca. I appreciate it.
Yes. Oh, gosh. Yeah. And listeners, I just want to remind you today beginning at 8:45, there will be a PSA screening, free screening for men with all types of Buffalo Bill swag. And don't change the dial. We have the second half coming up momentarily. Thank you. See you on the flip side. And now on to part 2. Welcome back to the second half of the Great Lakes Health radio program with your host, Francesca Messiah, Kaleida Health Workforce Manager of Workforce Development. Well, the second part of our show, I told you it was going to be extremely exciting, but the second part of our program, it's an organization that's been around in Buffalo for many years, and they recently moved on to where? From Main Street to Sycamore Street. And the name of the educational entity is Buffalo Center for Arts and Technology, BCAT. And today's topic is careers in healthcare, where to begin. And our guest this morning is Ms. Gina Burkhart. Good morning, Gina.
Good morning, Francesca. So nice to be on the show with you.
Oh, I'm so glad that our schedules finally coordinated for this interview. Gina is president and CEO, and she can tell you how many years she's been president and CEO because he's down upon me. I don't know, but she's
Yeah.
president and CEO of the Buffalo Center for Arts and Technology, also known as BCAT. That's BCAT. So welcome, Gina. How is everything?
Everything is terrific. So I've actually been at BCAT. It will be 7 years on Halloween.
Oh my
But
gosh.
I know. So it has flown by, and I am really so fortunate to be leading this amazing organization. And I'm really happy to have a conversation with you to tell you about what we do and how your listeners can join us in our work.
Well, and that's part of the first question to share with their listeners an overview of BCAT. And what I've learned for the past few years working with you, I don't think it's in all cities. It should be to me. But if you could share with the listeners an overview of Buffalo Center for Arts and Technology, BCAT, and is it in all major cities?
Yeah, no, you're right. It should be, but it's not. So BCAT is based on a model that was founded in Pittsburgh by Bill Strickland. And right now there's actually 14 of these cats across the country, but there's also a couple internationally. There's one in Puerto Rico, there's one in Israel, and right now they're opening one in Belfast. And in fact, the mayor from Belfast and his contingency were here in Buffalo visiting our BCAT to learn how to get a program up and running. So they are expanding across the country because they work, right? And they're delivering workforce training that actually matters in the communities where they're located.
Is there a way that, and I know is there a way that they determine, or I should say, how do they determine what cities?
So the cities actually do some research and they find this model. And then what the CAT Center, the main one, does is ask the community to do a feasibility study. And we did one here in Buffalo 12 years ago. So the founding funders for BCAT were M&T, the Oishei Foundation, the Community Foundation of Greater Buffalo, and First Niagara Foundation when that was in existence. And so they did a feasibility study to determine whether or not a center like BCAT was actually needed in the community and whether or not it could deliver the outcomes that were promised, which is employment for persons in the workforce training. They also, when they do the feasibility study, is determine what programs the CATs offer. So in Buffalo, the decision was allied health because, of course, we have Kaleida and many other health centers here in Buffalo. And they focused in the beginning on medical coding because it was an in-demand job, and pharmacy technician training, which is also an in-demand job. But we've expanded since then to include other courses.
That's great. And now, Gina, one of the reasons why we're having the show and what made me think about the show today, talking about the move and the move from Main Street to Sycamore Avenue and the programs that were offered before and when you were located on Main Street. What were those programs? And have you added additional programs since you've moved to Sycamore Avenue, and what's the address on Sycamore?
Right. So we were located for 10 years at 1221 Main Street, right across from Delta Sonic. And in that building, we had three adult classrooms and actually 2 adult classrooms and 3 youth classrooms. So in addition to the workforce program that we're talking about today, we do have an after-school arts and technology program for high school students in Buffalo public and charter schools. We'll talk about that some other time. But what we found out was that there were many more employment or career opportunities in Buffalo in the allied health field. And so we moved so we could expand our programs and offer more classes. So right now, moving to 368 Sycamore Street, it's a building that was abandoned for 40 years. We renovated it. We now have 7 classrooms for our adults, 5 classrooms for our youth. And the classes that we've added, again, based on labor market demand and market research. So we now have medical coding, we have pharmacy technician, those continue. We added phlebotomy that has a waiting list for 2025 already for 100 students. So we're adding more classes of phlebotomy in 2025. We're also doing technology training. So we have a technology progression training where people can get certifications from fundamentals through security. And when we were at our 1221 Main Street, we could really our capacity only let us train about 100 people. Now in our new building, we can train up to 250 adult students. And the thing I should mention is all of our programs are free.
You know what? And I was going to ask about that. So all the programs are free. So, so you said, let's talk. Okay, so you mentioned there's medical. This is for the adults,
right?
Medical coding.
Yep.
Medical tech. Is it technology or medical assistant? Did you say?
It's medical administrative assistant training, which is going to start in January. So if people are interested in that program, now is the time to contact us and sign up.
And phlebotomy. And technology. So if you could say, how long is the medical coding program? And when students finish, do they have a certificate?
Yeah.
When they come out?
Mm-hmm. So the programs are all different lengths and they're all approved by New York State Department of Education. So they have a lot of credibility behind them. The curriculum is rigorous. The requirements for completing are fairly rigorous also. But again, we have all kinds of supports in places. So our adults, 85% of them stay in the class and graduate. What happens is that New York State sets the timeline for the class. So for example, medical coding is 993 hours. It's a long program. It's 9 months. Pharm tech is 700, a little more than 700 hours. That's a 6-month program. Phlebotomy is 120 hours. So that's only a 4-month program. And then the medical assistant program will be 160 hours. So a little over 4 months. Every class ends in a National Health Association certification. Again, all paid for by BCAT. So you can take your exam. We cover the cost of the exam and we cover the cost of the certification. And again, 85% of our students get through the program, graduate, and are certified. The great news about the phlebotomy class is the last 2 classes, 100% of our students passed the certification exam on the first try.
Oh my goodness. And you know what? And we often we think about phlebotomists in medical environments, but I think someone recently said they're also now looking at phlebotomists at tattoo parlors. I don't know if that's true or not. Have you heard that?
Yeah, so we have. So there's now some requirements that happen in the States as tattoo parlors are now being more regulated, right? That people have to be checked for all kinds of things before they actually can, have the tattoo. So part of it is sometimes drawing blood or taking a urine sample. And that's what our phlebotomists do.
That's great. So before we go any further, if someone is interested in inquiring, signing up, learning more, how would they contact BCAT?
Yeah, so I think the best thing to do, because there are a couple requirements to get into the program, because again, it's a rigorous program and we want to make sure, because we get funded for these programs and our funders require us to be accountable, right? That we bring people in who who will complete the class and take the certification and then actually look for employment in the field. So we ask people to come into the organization. You can call ahead. You take a very short entry exam or assessment. Actually, it's not even an exam in reading comprehension and math. And if you don't get through the test the first time, then we have a tutor in-house, again, free tutoring to help you prepare, take the test again to get into the program. We try very hard not to turn anyone away. The requirements also are that you have to have graduated from high school. We ask for your transcripts from high school. And I know sometimes you're like, where the heck am I going to find my transcript? We help
Right.
you do that. It's an easy process, actually, and you have to have an ID. So it's not that hard to get into the program. If you call 716-259-1680, Phyllis or Star, who are at our front desk, will give you all the information you need to be able to register and apply and schedule a time for you to come in to take the assessment.
And could you say that number one more time?
Sure. 716-259-1680.
Thank you. So the students, let's say, do they have to have an interview as a GED? Can they have a GED? And is there an interview to get into the programs or age requirement to get into the programs?
Yeah, so GEDs are fine. It really is just that you have to have completed through a high school curriculum.
Mhm.
And, we do interview everyone who comes into the program, and it's not to eliminate people. It's much more to help direct them into the class that is really most interesting to them and that
Mhm.
they're really inclined to join as a career. So, for example, we've had some folks come in and say, I heard you teach phlebotomy and I really want to be a phlebotomist, but when they learn that being a phlebotomist means you have to take blood, they're like, oh no, I don't think I want to do that one. I'll go to be a
Right.
medical assistant. So the interview is really about, it's almost a support conversation. Let's make sure that you're making the right career decision for yourself.
Mm-hmm. No, absolutely. Now, the classes, the 9 month, 4 month, 6 month, are they morning class, afternoon, evening, or a combination of all of them?
Right. It's a combination. So medical coding and farm tech right now are daytime classes. So they're 9:30 to 3:30, Monday through Thursday. So it's a big commitment and they're long classes. But actually, when you're done, so for our farm tech, for example, and you know this, Francesca, they go through an internship as part of the program. And most often they come out of the internship with a job offer. So it is a long commitment, but it actually leads to employment. Our phlebotomy classes right now are in the evening, 5:30 to 8:30, and the medical assistant program will probably be offered in the evening also.
Okay, so people can either work during the day, take care of families. Yeah. Okay. Well, no, that's great to know.
And
How-
in January, our
Mhm.
phlebotomy class, because we have such a long waiting list, we're going to do both evening and daytime classes in phlebotomy.
Yep. And you know what else I didn't ask? What's the size of each class?
So we're really, really committed to making sure that whoever comes into the program that we can support so they retain in the program, that they graduate, that they get certified, and that they leave. So we keep our classes pretty small. So the max that we take in each class is 15, but we also have on staff a social worker and retention counselor. So we have a lot of wrap supports as people, it's hard to navigate your life and be in school. So we make sure that we have on site people you can talk to or help you find resources if you need them outside of the program. We have a wonderful kitchen. And so we try to keep food stocked for our students when they come in so they're not hungry while they're in class.
So you keep food staff for the students? They don't have to bring their lunch or?
Well, you know what we find is that a lot of students who are coming from, a part-time job or running quickly from one place to the other often don't have time to bring their lunch. And so we try to keep snacks and things available, because if they're there from 5:30 to 8:30, that's through their dinner hour. And they have a little bit of a break. And so we try to keep the kitchen stocked so they can, make some soup or make themselves a sandwich, things like that.
No, that is great. That's really wonderful that, it's not a meal, but they will have some snacks so they can continue learning and studying.
Right, right.
Yeah. So you said all the programs are approved by the New York State Department of Education.
That's right.
Oh, great. Are there any, let's say, wish list programs that BCAT is thinking about?
Yeah, so we've expanded outside of allied health, because again, what we know is that another big driver of the economy in Buffalo is the technology, right? And that
Yes.
this area is fast becoming a technology hub. So
Mhm.
we are now offering IT fundamentals, IT technical assistant, which is like a help desk class, IT networking, which is that's a pretty in-demand job right now, and then IT security. We're also looking at adding an accounting class. What we're finding is, and what we're hearing from the community is, there's a real shortage of accountants across the board in all kinds of organizations. And there's a huge demand. And that, again, if there's a an accounting fundamentals class that we can offer, we can help put people onto a pathway of accounting. And I think that's something that we would get a lot of interest in.
Yeah, plus I also think of the whole of entrepreneur. We have several small business entrepreneurial training as a partnering possibly with some of the entities, be it Buff State, some of the entities that teach how to be an entrepreneur, because
Right.
all part of that is how to keep up with your finances.
Right. And in fact, we just had a conversation with some folks from Buff State about
Oh,
partnering. So we're
I
really,
didn't know.
the great thing about BCAT is that we know we can't do it alone, right? And that partnering and collaborations always make things better, which is why we love Kaleida,
Yeah,
because
thank
it's such
you.
an amazing partnership with you. And, for the accounting, we would look to probably UB also for some support.
Yes, no, and of course we too have accountants right here.
That's exactly, we all
I just
need
remember,
them.
I just remember a little bit of counting. It was like Philo first in, last out, and then Milo first in, first out, and last out in terms of keeping your record straight. So that's about all I remember of working in banking.
I think you know more than I do, because I don't even know what that
Okay. But you
is.
know what? That's why you have the the instructors. Let's talk a little bit about the instructors. What's an example of the background? I mean, your program is successful. You can look at the data to show the success of the program. Let's talk about the instructors, who must be excellent, because that's all part of building on the success.
Well, we have the best team of instructors ever. So our medical coding instructor has been in the organization for over 8 years. She went through medical coding program at BCAT. She went out and worked for a few years and came back to be a full-time instructor at BCAT. Our pharmacy technician instructor is a pharmacist, right? And she
Nice.
again worked in the field, came back because she wanted to give back to the community, and is teaching the program. Our phlebotomy instructor works at Kaleida. She took our class. She has a full-time position at Kaleida as a phlebotomist and teaches at night. So all of our instructors, our IT instructors, again, one of our IT instructors is the lead security person at M&T, right? So all of them are sort of daytime, full-time jobs. The ones that teach in the evening. And then because they're committed to the community and committed to giving back, they bring their professional expertise to the classroom. They're amazing. All of them are highly qualified.
So, yeah, I know they really are. Besides Kaleida, what are well, not even besides Kaleida, but what are the percentage of students that graduate, and what are examples of some of the places of employment?
Yeah, so the allied health, because we've been delivering allied health programs for, 10 years, we have a lot of really strong partnerships with community organizations. So our students, 85% of them graduate, 70% of them find careers and employment in the field. Kaleida, ECMC, Roswell, our farm techs are working at Wegmans, at Rite Aid, and other sort of either retail or hospital pharmacies across the region. Our adults are most often born and raised in Buffalo, and
Right.
so they really find and stay in the community and give back. One of our graduates in medical coding is now doing remote medical coding for Rush Hospital in Chicago, right?
Oh my gosh.
Yeah, so they have a lot of success once they leave the program.
And that's great. I mean, and to give a salary range, not what people make, but what's the salary range? After you complete the program,
Yeah.
pass your certification, what's the range of salaries?
It's really increasing because the demand is so high. There's
Yes.
so many openings right now. So for the allied health, when we first started, when I started 7 years ago, the range was about 16 to 18. We're seeing over $20 to $25 an hour for a lot of these positions, entry level or first in kinds of positions with lots of opportunities for advancement. So what happens for some of our students is they start out as a phlebotomist or a farm tech person, but they move, in or get promoted into more of a management kind of position because they're so work ready when they get on the job.
So you're work ready. I don't think I quite said, what's the average age of the student? Because it's more of an adult learner. They're not necessarily 17 coming out, or are they? I don't know. I'm just guessing.
Yeah, no, so the age range for our students is about 21 to 45, but the average age is about 35. So these are for persons, the majority of them are underemployed. They want a second career or come back into the workforce. They may have been out of the workforce for a while and want to get back in. Majority of the persons in our allied health classes are female. Again, most of them single moms who just really want a career and to be able to support themselves and their families. So about 35. The IT classes are a more diverse mix of about 50-50 men and women. And again, about the age range of about 35. Although we're seeing a little bit younger in the IT classes.
Okay, thank you. And I just wanted to let people know that our listeners know that at Kaleida, we hire all ages, just in case you were wondering. And I believe all the organizations mentioned hire qualified persons at all ages. So it's never too late to begin. It's never too late to begin a career.
Yeah, thank you for saying that because that's really important. We do not see any age discrimination with our adults because what we do with them, besides doing all the technical training, is that we do resume writing support, we do interviewing support, we do a lot of professional development support. So what does it mean to be responsible and accountable on a job, like on time, right?
Yeah, the
Navigating,
soft skills, yes.
right. So all of that is part of the curriculum.
We only have a couple minutes left, but could you just talk about some of the programs that target high schoolers?
Yeah, so we have 50 high school youth that come into our program every day. These are the most talented, amazing, wonderful teenagers ever. So we offer 3D printing, we offer fine arts, and our fine arts class does a lot of murals around the city. We offer music production, which we have a fully state-of-the-art recording studio in our building right now. And we do digital media, which is all about photography and videography. So they learn how to do podcasts, they learn how to do documentaries. So the kids come, they hate that I call them kids. So the teenagers, the young adults,
Young adults, yes.
come from 3:30 to 6:30, Monday through Thursday, and then Friday is a studio day for students that want to come in on Friday. Again, our 3D instructor, to give you an example, is an instructor as on the faculty at UB, and he teaches in the School of Architecture. And what he teaches in the School of Architecture to his graduate students, he's now teaching to our high school youth. 14
Yeah,
of our 14 of our students last year were seniors. All of them graduated from high school, and all of them got into the college of their choice. And one of our students got a full scholarship into the School of Architecture at UB and received a really amazing scholarship through Majority Leader Crystal Peoples-Stokes' office.
Oh, wonderful.
Yeah.
And I just want to say, you know, we know we could talk on and on about BCAT, Buffalo Center for Arts and Technology, but I just want our listeners to know this is just a sampling of a gem of an organization in our community on Sycamore. What's the address? You know what? Not only it's what's the address, Gina, on Sycamore?
It's 368 Sycamore Street. It's on the corner of Mortimer and Sycamore. Please come by. We're really committed to the neighborhood and to the community and to really the work that we do in building careers for both our young adults and our adults in these programs.
Mm-hmm. No, and I want to say that's just great, and you mean it. It's a very relaxed environment when you walk in. You know, it's just very comfortable. It's amazing how the expansion, because I never walked in the old space before thinking that there wasn't enough space. But when I walk in the new building, I'm like, wow, this is a lot of space. I see why they moved.
Yeah, we're incredibly fortunate and so happy to be in our new building.
Yeah, no, thank you. And Gina, any one last closing remark you want to give us a phone number, how to reach
Okay.
out. Yes.
716-259-1680.
And
And you can also go to our website, you know, it's a BCAT website. And please come by. Just come by and
Yes.
say hi. We would love to meet more of the community.
Yes. And Gina, thank you so much. You know, I
Thank you,
hope
Francesca.
everyone, I hope your phone begins ringing off the hook because you really want to meet Gina. And you want to meet her staff because they are amazing, very easy to work with. So I want to thank you for being our guest this morning on the Great Lakes Health radio program, and the topic Buffalo Center for Arts and Technology, BCAT, careers in healthcare that they have a plethora of, and where to begin. And it's never too late to change your mind on beginning a new career. It's never. Thank you, Gina. Oh, you're welcome. You're welcome. And listeners, I just want to say, hopefully I'll see you in about another half hour at our, we have a PSA screening working along with Cancer Care of Western New York Urology, right here at WUFO 143 Broadway Avenue. And it's from 8:30 until 11:45 a.m. So it's this morning. Come and get screened. Come and get screened for your it's a simple blood test, PSA, and enter into a drawing for many prizes, including Buffalo Bill swag. Well, next week you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center, known as ECMC. And I know she'll have an exciting topic. And until then, God be willing, you will hear my voice in 2 weeks, the second and fourth week of each Saturday of each month. Francesca Messiah, Polita Health Manager, Workforce Development. Bye-bye.